Hey parents, let's talk about ADHD, specifically ADHD testing. Whether you've already taken your kid to get checked and see if they have it, or you're going and you're wondering for yourself, do I have it? You're asking these three questions. Number one, do I have it or does my child have it? Number two, is there testing for it and what subtype do I have or what subtype does my child have? Now, medicine has 6 different subtypes for ADHD, but in this video, we're going to break it down and make it way more simple. We're going to talk about 2 and really 3 different subtypes when we really understand the neurology behind ADHD. And the third question you're thinking about is, what can I do about it? What should I do about it? Are the psychoactive, highly addictive side effects that ADHD medication comes with really worth it? And is that really my only option for my child or for myself when it comes to ADHD? Or do I have other options? Many parents are waking up and realizing, hey, I don't want to just fill out a questionnaire to fill out a survey and then have the label of ADHD put on my child. I actually want to understand and see and test and measure and track, does my child actually have ADHD? They want to know, can we really find the root cause of ADHD, the neurological imbalances and dysfunction that comes with ADHD, and how to harness that and go from struggling to thriving. And once we figure out and understand the science behind it, we realize that it's not just genetics and it's not just a chemical imbalance that's causing ADHD. And parents are now waking up to the fact that it's actually not just genetics and it's not just the chemical imbalances, but it's an imbalance or dysfunction of the neurophysiological aspect of a child during development. Especially, we'll talk about more about how it shows up earlier than we think, and parents are realizing and wondering, can we test it? Can we really see what's going on at a deeper level? And the answer is yes. We're going to talk about the types and the science and the testing, and then we're going to talk about the drug-free option and the drug-free path that you as parents, and maybe for your child or for yourself, what you can do about ADHD. I'm Dr. Nicole, a neurologically focused pediatric chiropractor with Sprout Family Chiropractic. And for so many kiddos, so many individuals that have ADHD, they struggle to sit still, they struggle to stay calm and be able to focus and pay attention. They struggle with following directions. Now, from a neurophysiological standpoint, ADHD can be a blessing or a struggle, depending on how we approach taking care of it. In a second, we're going to go over the tests and the scans that we do in our office that are specific to your child and ADHD and what's going on at a neurological standpoint. But I want to tell you this, and you already know this, and I'm just affirming what you already know, parents. Your child's ADHD is their brilliance, their creativity, their intellect, their capacity, their amazingness. They can do so much with ADHD. We just need to understand and need to know how to harness it. In fact, some of the most brilliant high-level engineers and entrepreneurs and inventors and CEOs and all of them, they have ADHD and they just know how to harness the power, and so they're not struggling, they're actually using it for what they want to do in life. And to understand how to harness it, we need to know how to take care of it, and whether it's going to be medications that suppress it or neurologically focused care that is going to help create more balance, but also not change who your child is at the core, or not change who you are at the core. So I mentioned that there are 3 different subtypes of ADHD. The first one is raging bull, and the second one is drunken bull. Raging bulls are always super talkative, they can't sit still, they're always moving, they can't seem to focus or concentrate. They struggle to sit still, they struggle to fall asleep even. And that's because they have what's called too much gas pedal or too much sympathetic dominance, or the sympathetic nervous system is ramped up too high for the vagus nerve and that parasympathetic side of the nervous system to counterbalance. And the second subtype is nicknamed for not only its neurology, but also its presentation, and it's the drunken bull. They're not hyperactive, they're not impulsive, but instead they have trouble incorporating or coordinating or processing things. They have trouble organizing things. And they may even struggle with physical and emotional regulation as well. And the third subtype is actually a combination of these two, the raging bull and drunken bull. And really, when we have kiddos that are this third subtype, usually one of the first two subtypes is leading the way when it comes to how your child is presenting. And I've got to say, from our experience, the raging bull is more common. Now let's talk about our tests for these raging bull, drunken bull combination kiddos. They are called insight scans. And wherever you're finding this video, I promise that we're going to have our written form, our articles, the what is ADHD, and our ADHD testing articles that talk exactly about what we're going to talk about in this video, the subtypes, the testing, what you can do to help support your child. So make sure you look for those. Now let's look at a starting scan of a 9-year-old boy and his nervous system with everything that we talked about with that first subtype, the raging bull, the hard to sit still, have to move, the hard to pay attention, hard to focus, and all of that comes with the raging bull subtype. Now, what's cool about this technology is we run it every 4 to 6 weeks or every 12 visits, and we can really measure, track, and see what is going on at a neurological level as they go through care when we're taking this neurological approach to ADHD. We can actually see the changes in the brain and the nervous system as it calms down, as they're getting those neurotonal adjustments, those safe, gentle, specific, and effective neurotonal adjustments all throughout care. And we get to see the amazing changes that's happening at the deepest level to allow your child to harness their optimal potential. So like I said, what we're looking at is a 9-year-old boy's scan, and he had a rough start. He had, a really hard, there was a lot of prenatal stress. There was a lot of, stress during the birth process. He went and had a NICU stay. He had infections, ear tubes, colic. And when parents go and tell their pediatricians, my baby has colic, they're fussy, they are told that it's fine, they'll grow out of it, there's nothing to worry about. And the thing is, they don't grow out of it. It's the same neurology that comes with a colicky, fussy baby is the same neurology that turns into ADHD. So I want to really dive in, and we're going to really hone into what these tests and these scans tell us. Because over time, it not just turns into ADHD, but it turns into sensory processing, it turns into meltdowns, it turns into, the things that parents start to see that are different presentations or manifestations of what we see at a neurological level at ages 3, 4, 7, 8, 9, 14, 17, 18 years of age. All of it is being tracked and measured early on, or can be tracked and measured early on, but it's just being swept under the rug by certain providers. So this scan right here is a neurosensory scan. It's called EMG, which is short for electromyography, and it detects and measures and tracks what's going on at the neurosensory level when it comes to the neurospinal level and the neuromuscular level. Now, the neuromuscular system provides 60% of information that goes to the brain and the nervous system about what's going on down below the brain. And about 33% of that comes from this hugely important area, the brainstem, right underneath the brain and this upper neck region. So things like birth trauma, forceps, vacuum extraction, manual assistance, and emergency C-section, they often get overlooked as, the starting point of these struggles. But it's so important to realize that affects this area right here, this really important area, this upper neck region, where all of that input from the neuromuscular system is feeding the brain, telling it what's going on. And then that's where we get the symptomatology of ADHD later down the road. We aren't about the diagnosis, we're about the neurological root cause of what is happening at a deeper level. And when we're looking at the scans, we're looking at a scan of a kiddo who has a lot of neurological stress. Now, the more color, the more tension, the more stress. You see the blue, the green, the black bars, All of that is indicating neurostress. This child's nervous system is just stuck in that sympathetic fight or flight, foot on the gas pedal, go, go, go side of the nervous system. And in that state, the brain is just being blasted with information 24/7, and it's a lot. It's overstimulating for the nervous system, for the brain. And what's amazing about these scans is we can actually score that information that's going to the brain. So all three of these numbers right here, the pattern, symmetry, and total energy, they should be around 100, maybe 150 for children. And what we look and what we see right here is that is not the case for this kiddo. Now, when we do these scans, your child's seated and relaxed and, hanging out while we do these neurosensory stress tests, and they're really just chilling. They're chilling, and it takes less than 5 minutes, and they're really relaxed. Now, what we see with this child's nervous system is the total energy right here, this number right here. Like I said, all of these should be around 100. It's actually 400 plus for this child. And that means the nervous system, the sympathetic nervous system specifically, is revved up to more than 4 times the amount that it should be just at rest. This amped up energy, this 400 plus total energy, this shows us where exactly the cancids still have to keep moving. They need to really just keep stimulating their nervous system to match the output and the input. And now we understand, as we look more and more over time with these neurological scans, that this is where all of those things with the raging bull kiddo, where it's rooted in. And this pattern score right here is really a neurological, nerdy metric where it shows us the organization and the coherence of the information being fed to the brain, from the nervous system, from the body. Once this number dips below 75, that's when we start seeing a little bit of focus and concentration struggles, a little more of that drunken bull subtype 2 ADHD child. Now, that's a quick preview of our testing for ADHD kiddos, and what we see is this. With parents who bring their child in, when parents themselves are coming in and wondering, do I have it? Can you test it? Can you track it? What can I do about it? Is there a drug-free option? The answer, like I said earlier on in this video, is yes. It's just a matter of understanding the neurological components and the neurological baseline for you, for your child, to really understand how to best support where you start, or where you're starting, where you want to go. Because we want to activate the parasympathetic, we want to activate the vagus nerve, we want to be able to counterbalance that gas pedal with the brake pedal, and we want to be able to, like I said, not suppress who you are, who your child is, but really harness what you're capable of doing. And that's exactly what our protocols in our office do. We use neurotonal adjustments, our techniques, all of our techniques. We understand where you're coming from, where your child's coming from at a neurological point or standpoint, and we use that to create custom care for you, for your child. We're not treating, we're not curing, we're taking care of and supporting the neurological function of your brain, of your nervous system, of your child's brain and nervous system, so that you and your child can operate and function at the most optimal level possible. If the gas pedal is on overdrive, if your nervous system is in that fight or flight, sympathetic dominant side, the simple, effective, safe, and gentle adjustments that we do both on children and on adults, it helps recalibrate, reorganize, restore that coherence in that neurosensory, neuromuscular information that's feeding the brain. It's a drug-free option for care for ADHD, and all of the side effects are amazing. Like I said, if you want to learn more, read more. Look at our article on what is ADHD, our ADHD testing, those 2 articles. We really, like I said, dive into more of the technology, the understanding behind the 2 subtypes, and it really speaks to how we know ADHD at a neurological level in our office. And if you learned all that you need to know and you want to come in, get scanned, get tested, if you want to do that for you, your child, please give us a call, send us a message. We are here to help. Thank you for watching, and we'll see you on the next one.